HIV or hepatitis transmitted. It's supposed to be very safe and very long lasting, but again, there are always risks involved. And then if you used your own tissue, the disadvantage with that is it's longer time under anesthesia that you'll need, and as well as more pain after the surgery. So there are advantages and disadvantages to all types of slings that could be used. And then the next thing that could also be used is an open bladder suspension, which probably isn't done as much as it used to be. It's an incision through a bikini line incision where the bladder is lifted from above and tacked up to the pubic bone a little bit higher than it was. Probably not done as much as it used to be. But those are all possibilities for stress incontinence. Again, if this is the urethra right here, this is the bladder, this is a woman's body cut through the middle, the urethra, bladder, the uterus back here, the vagina, and the rectum. That's where the ovaries are. Again, this is a picture of the pelvic floor. You can think of it as a hammock, and this is what you're actually contracting. And when you squeeze, you're trying to squeeze the muscles up toward here, and you can feel the strength of the muscles around here increasing. And this is just another picture of the pelvic floor from the outside. Again, this is what your gynecologist sees when they're doing your exams. If this is the clitoris, the urethra, the vagina, and the rectum back here. This is the floor of the pelvic floor that you're contracting to try and strengthen the support to the urethra. Sometimes another reason for people have incontinence is when this pelvic floor is damaged or becomes weak over the years. You might hear people talking about dropped bladders, and that's when you'll see some tissue. Some people describe it as like a little nubbin or a little egg-like protrusion from the vagina, and that's just their bladder that's starting to descend. And I'll show you another way to look at that. Or sometimes the rectum can also push onto the vagina. Urge incontinence, again, urge incontinence is the key in the door type syndrome or the sudden urge to urinate. We've discussed most of these already. Kegel exercises, plus or minus estrogen, biofeedback. These can also be very good for urge incontinence. Anticholinergic medicines are things that we've seen advertised on television a lot lately. Things like Detrol or Ditropan. They're now in a once-a-day formulation. They're patented. They're a little more expensive than I'd like to see because the costs become an issue for a lot of people. It probably costs about $75 a month for the medicine. There are generics available, but they're not as effective and they have more side effects. There are medicines that you can take 3 times a day, but again, this is a good alternative for some people. Some people don't like to take medicines or they don't want the side effects. About 40% of the people will have complaints of dry mouth or constipation. And again, you just have to decide what's more of a problem for you, the side effect of the medicine or the incontinence. Neuromodulation is something that you might hear about once in a while. It hasn't really become too well accepted, but that's basically a pacemaker for the bladder. And the way that's done is a little wire is inserted into one of the spinal nerves at the base of the spine, and just a little electric stimulation is used to stimulate the nerves to the bladder so that you don't have as much overactive bladder. And then there are always surgical procedures to enlarge in the bladder, a piece of intestine that can be used to put on top of the bladder to make a bigger bladder. But again, your incontinence has to be very severe before you even make that an option for yourself. And again, even though you're not having incontinence, some people can have a lot of frequency and urgency when they feel like they're going to the bathroom all the time. And the amount of information that you need to have to process all of this and to figure out what's best for you can be overwhelming. So I really recommend that if you're having problems with overactive bladders or incontinence, that you talk with your physician and figure out what's best for you, because there's so much information that I know it's difficult to try and sort out, when to go to the bathroom, when not to go to the bathroom, to stop fluids after 6 p.m., whether or not that really works. Everybody's different, and you just have to talk with someone to help figure out what's best for you. Again, some people can be very sensitive to caffeine intake. If they drink a lot of coffee in the morning and they notice that they're going to the bathroom a lot in the morning, we can offer, try cutting down on some of the caffeine. Some people can be very sensitive. Some people a lot of older people make a lot more urine at night because when they lie down, it's easier for the blood to return to their heart. Their heart pumps more blood to the kidneys, and the kidneys make more urine, so the urine has to go